Hi, this is Dr. Sunil Mankad from the Mayo Clinic, and it's great to be here in beautiful Mumbai as part of the World Congress of Cardiac Imaging, the third annual. Today I'm going to give a lecture on strain imaging and practical applications. We review the importance of strain imaging, which can detect subclinical left ventricular dysfunction. We then look and see where it can be used. Certainly in infiltrative cardiomyopathies such as amyloidosis, it plays a role not only in early identification of cardiac involvement, but also in prognostic importance of the abnormal strain values. We then move on where it's clinically used currently to separate different types of increased wall thickness, to separate hypertrophic cardiomyopathy from amyloidosis, from just hypertension. And although not 100% accurate, it certainly can point you in the right direction, and perhaps other diagnostic clues can then be obtained to separate out why heart walls are thick. We also utilize strain imaging to detect subclinical LV dysfunction in patients on chemotherapy. Certainly, patients that develop cardiac dysfunction on chemotherapy can be quite serious and often can lead to eventually problems with heart failure and even death. So detecting that and being able to prevent further deterioration is important. A drop of about 15% in strain values is definitely going to be clinically significant. And because strain is more reproducible and more accurate than ejection fraction, it really is important to look at this and continue to accumulate data in the setting of chemotherapy-related cardiac dysfunction. Finally, to detect early subclinical LV dysfunction in patients with valvular heart disease can also be important. In asymptomatic aortic stenosis, strain imaging has been demonstrated to really prognosticate how survival occurs. And in addition, even though current guidelines may be met in patients with severe mitral regurgitation, you can unmask subclinical LV dysfunction by fixing that mitral valve, and you can detect that early subclinical LV dysfunction better with strain imaging than you can just looking at the size of the ventricle or the ejection fraction. To summarize, strain imaging is still at an early phase of development, but we need to learn how to accurately measure it because it is quite reproducible and will play an important role in future care of our cardiac patients. Thank you very much.